Okay, so we have hospital transfers. We made a little PowerPoint. You guys can share and look over.
Yeah, very nice.
Okay, so you have a patient that needs to be transferred. What do you do? So first, you're going to call 911. Another RN or the anesthesia provider, really anyone can call 911. Someone should be staying with the patient at all times. So if it's your patient, you may not be the one who is calling report to 911. They will most likely need ACLS providers if the patient has an IV and they've already been admitted. The 911 operator will ask you a lot of questions. You're going to give a phone number and which suite you're in and give a brief report on the patient. Some questions you may be asked: Are you with the patient now? Are they showing any signs of shock? Are they breathing normally? Any pain? Are they awake and alert? And do they have an IV? So you're just going to run down what happened and give them a brief report on your patient. We do have checklists at the front nurses station in GI in the little folder section. So you'll have, so we have the transfer protocol, which is basically what I have in the PowerPoint, and then also a checklist that you're going to fill out. We also printed out the policy for you guys to look at. On the checklist, it's important to note what time you called and then what time they arrived. After the patient is gone and this is complete, you are going to give that paper to Paula. Someone will be able to assist you in copying the chart. And you want to copy papers that are important to the patient's history, pre and post-op sheets, anesthesia record, the OR record, the PACU record, any lab work they have that's on the chart, EKG, HMP, if they have any office visit, things like that. That should all go to the EMS. You also want to give the patient a copy of their discharge instructions, and their belongings should go with the family. So things to remember, like I said, someone should remain with the patient at all times. Obviously, if they're being transferred, there's a good reason for it, so keep in mind, should they be on oxygen? They should have an IV if they don't already. That's really it. Any questions?
We do an incident report too, right?
Yes. So after the patient has gone and you've gotten all your notes together, you're going to fill out an incident report and give that paper with the checklist to Paula.
We created a little list of things that should be copied from the chart, so in case you don't remember, because that's hard to remember. So in the file where you pull out these papers, right in the front, in like what has like a little page cover on it, it says what you should copy. Amber knows typically what to do, but in case we don't have Amber or you're not sure what to do, that'll tell you what to copy.
Yeah, that's on the transfer protocol.
Yeah. Transfer protocol is very helpful if you've never done it before. If you just follow the steps, you'll be fine. It's also important that we do get the physician's signature on the sheet that is part of the record, because it's considered an order for transfer. So in other words, this is the patient, and they write a little blurb why the patient's being transferred, and they sign it. And so, like I said, the surveyors look for that.
The doctor or the anesthesiologist.
Or either one,
Right.
yep. Yeah. But it needs to be a physician for an order for transfer, and that's considered your order for transfer.
And where is that written?
It's on the sheet that you document with. So as long as they write the little blurb and then sign it, says physician signature, make sure that that is signed by them. I've gotten them sometimes where it didn't have a physician signature, and then I had to kind of like track somebody down and get them to sign it. But so
Usually anesthesia screens are right.
yes.
It's the doctor.
Yeah, because they're not aware sometimes that they need to do that.
Yeah.
So if
Like
you're the
they
nurse,
if they said I want them to go in non-anesthesia.
then say that again.
So if the doctor said I want them transferred, and let's say anesthesia wasn't involved, what if there's
Correct. Typically
have
it's
to sign
anesthesia,
non-anesthesia,
but
right?
if anesthesia isn't like involved with it or whatever, yeah. Because sometimes there's a medical reason why they're
Right.
going versus an anesthesia slash, yeah, reason. Okay. All right, any questions? I've seen them before send a BLS crew, and then the ACLS crew comes behind them just because of availability sometimes. If the patient has an IV, then they have to have the ACLS crew, and that's the majority of our patients. But I've seen them send BLS, and then ACLS was right behind them, so.
When I've seen the BCLS, if they have an IV, if you turn it off and put it on the bed, they
Right.
will take them.
Or cap it, they will, right.
Well, we
Yeah.
can't cap it,
We
we don't
don't.
have caps. So they just say, turn it off, put it on the bed, and they'll take it that way,
Oh,
without decannulating the patient.
okay, good enough.